Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins, and joining us today, Pepin County Health Officer Heidi Stewart, and we're going to talk a little bit about the COVID situation. And Heidi, thanks for joining us today. Well, numbers-wise, at least for those in the hospital that I know of, that's kind of staying stable.
Yeah, numbers-wise, we've been pretty consistent. Again, I think I referenced last time we talked since the beginning of the year. We continue to have single case numbers pretty much every single day. We are also having single testing numbers every single day. So we've only had that one day in 2021 where we had 10 people positive. Our testing numbers are down, our case numbers are down, the percent positive is down, but if you only test 4 a day and 2 of them are positive, it's going to be a little bit higher. But that, when those numbers are so low, that's really not something that we can look at and say this is a good reflection of what we're seeing. If you go to that Harvard map or the state of Wisconsin map, you'll see that it's actually starting to turn a color different than red. So for the longest time, the whole nation was red. And now if you look at Wisconsin, there's some areas of Wisconsin that are orange. If you look at Minnesota, there's some areas of Minnesota that are orange, yellow. So case numbers in general are starting to go down. We have had a total of 775 cases in Pepin County since the beginning of this. We have had 7 deaths. No new deaths since the last report, and 2 hospitalizations. And I think those individuals in the hospital are the same 2 that were in the hospital last time I reported too. So some lingering issues with those that are in the hospital. Those are our numbers for right now.
And I know that I know the Pepin Education Board, the school board last night, they had their meeting, and that the Pepin Alma girls, they have to be quarantined now because apparently they got exposed to one single player. So I guess explain how that works then. So they obviously can't play any games for a couple of weeks, but they also now have to just stay at home. Is that kind of how it works?
Yeah, so we've been dealing with that in Pepin County really since the beginning of school. Their quarantine is very, very similar to that if you're exposed anywhere else. So with sports, or any other school-related activity, we should all know by now that there's a certain degree of risk. And to use the Pepin Alma girls basketball team as an example, they traveled to another school. The team played a complete game, actually 2 games, one with their varsity, one with their JV. And then somebody on that team of that other school began not feeling well at some point following the game. They tested the next day, they came out positive. So even though our girls are doing a great job with the masks, the other team did a great job with the masks, that whole team, anybody that played then has to go through that quarantine. So for quarantine purposes, they can follow that shortened time frame where with a negative test on day 7, you can return to school activities with some restrictions on day 8, or you can return on day 11 following 10 days of quarantine, again with those restrictions until the complete 14-day quarantine is completed. That is school only. That is your job only. That is not for just normal day-to-day things. For sports, it's the full 14 days regardless. You can't test out of a quarantine that would allow you to come back to sports quicker, at least in Pepin County. Now, I am aware of some schools and I'm aware of some counties that may be doing things a little bit differently, but I've actually had conversations with those and I'm really questioning. For example, there's a school that's reviewing the film, and if a player didn't guard that particular person that tested positive after they played the game, then they're not including that as a close contact. I personally don't have enough time to sit down and watch a film. I don't know if our administration do. There's the whole concept of not everybody wearing the mask correctly. So there's that. there's also people touching the ball and different things. So I'm not 100% on board with that. I certainly would like to see our kids be able to get back to normal activities as quickly as possible. But I think for the purposes here, the superintendents and myself are all on the same page, and we're just doing, if another player or somebody on the team tests positive within that 48 hours, then the team will be excluded. Now, along those same lines, we have had conversations, and there's nothing formal written down or no specific plans in place, but we are having discussions about how to return to normal and potentially host a prom and potentially return to some type of normal type of graduation. So know that those talks are in place, and we're hoping that we can find ways to do some of these things with safeguards in. So my assumption would be that those events will take place. It will be different than it was prior to COVID, but those events will happen.
Talking, excuse me, talking with Heidi Stewart, Pepin County Health Officer today. Heidi, speaking of testing here in Pepin County, we've had that testing site on Thursdays, but that's actually going to be coming to an end, right?
Yeah, so our testing numbers in general have been really low, but our testing numbers at that test site and low as well. And that is not the best use of our National Guard resources at this point if we have access to testing elsewhere. And we do. We've communicated the fact that we're shutting that site down with Advent Health, so they're aware. There are other options. So I do want people listening. If you have trouble accessing some type of test, let us know at the health department, and we will look to find you some different options. There are still the mail-in versions, the at-home testing. It's possible that we could start to partner with agencies such as our library to have those on hand. You take them home, you do your test, you bring it back and drop it off as a UPS drop site. So we need your feedback. We need to know if there's issues so that we can make sure that we've plugged those holes.
Talking with Heidi Stewart, Pepin County Health Officer today. We got some really incredible news, and I'm sure yourself, Angela Jacobson, and even the folks at Heidi Pharmacy were all flabbergasted on Friday night into the weekend that we had 1,000 doses coming to Pepin County.
Yeah, it's absolutely great news. Prior to this week, we had only received within the county 300 doses, all of those doses being to Advent Health, where we were partnering up to get those phase 1A individuals vaccinated, and then fire and law enforcement, which are part of 1B that were added. And with the announcement that we were going to be able to go ahead and vaccinate 65 plus individuals this week, we were all very aggressive with our vaccine requests, and we received, actually, Heidi, I think, actually received more vaccine than they had actually requested, which is wonderful. But over 1,000 doses are here in Pepin County. I know the hospital and Heidi Pharmacy have been busy putting those into arms already, so people have been receiving those already. Thank you goes out to Heidi Pharmacy. They took the assisted living facilities that we have here, which are only 2, but they took responsibility and made sure that those assisted livings are vaccinated instead of waiting for that long-term care pharmacy program to get to Pepin County. So kudos there. The hospital is reaching out to everybody that is in their clientele list and taking other individuals. And they're vaccinating Wednesday, Thursday, and Friday. And we are doing a huge mass clinic on Saturday. So just so everybody knows, we did take that wait list that we had started, and we grabbed the email addresses off of that wait list and sent out a mass email to all of the individuals. Individuals who had not put email address down received a phone call, and our human services department here has been partnering with us to make those phone calls and get people signed up. There's a lot of people that were on 2 or maybe 3 lists. So we're calling some of these individuals, or we're emailing them, and we're getting the message back, hey, I already got signed up for Heidi, or I got it at Mayo Clinic, or I got it at Advent Health. That's great. That is fine. There's no issues with that. We just want to make sure people are getting it. So very exciting that we will be in a really, really good place after this week as far as completing phase 1A, completing a good portion of law enforcement, fire, and 65 plus that reside in Pepin County. If you are 65 plus or in phase 1A or a fire and law enforcement and have not received your vaccine yet, please visit the Pepin County website, visit the COVID page, and get yourself on that wait list, because we will do the same process for the next round of vaccines that are coming, which we anticipate coming next week. And we hope to be holding some clinics during the week next week to give some additional vaccines.
So for those that will be participating in this clinic, they already know then where they have to go and what time and all of that on Saturday.
We were able to use some scheduling software. So people should have received an email with the location, and then they should have scheduled their appointment time. We are hoping to do around 60 people an hour. So it really doesn't pay to show up early. We've been trying to message that. I'm going to go ahead and kind of go through the lingo with them. We have you scheduled. If you're 65 or plus or 1A, you qualify and you're eligible. Please show up at your scheduled time. It does not benefit you to show up early. The parking lots are going to be full with the people that are ahead of you. Show up at your scheduled time. Hopefully there will be parking spaces up towards the front then that will be available to you. We'll screen you when you come into the door. We really would prefer anybody who does not have appointment, don't show up, because we don't have a vaccine for you. If you do have an appointment, we ask that you call us if you're sick that day or for some reason can't make it, so we can make arrangements for that vaccine to go to somebody else. If you've been diagnosed with COVID in the last 10 days or in a quarantine, we ask you to wait till that quarantine or isolation period is done and you're feeling better. If you've received plasma therapy or any other type of treatment for COVID in the last 90 days, we need you to wait that 90 days. We have asked people that have had allergic reactions in the past to make their appointment with their regular scheduled or with their regular healthcare provider, just so they're familiar with what your allergic reactions have been and they can properly manage in case you do have allergic reaction to this. Everybody should expect that their appointment will take approximately 30 to 45 minutes. That includes the screening, the registration, the vaccination, and then a 15-minute required observation after you leave. We are teaming up with a lot of partners, so we will have Durand Ambulance available that day to help in the observation area. We're having the City of Durand Law Enforcement to help with the parking lot for directions and traffic flow. And then we did use our Wisconsin Emergency Assistance Volunteer Registry, which is a registry that anybody can sign up for. And we did a request and we've got a large number of volunteers that are going to be coming in that day. We have, I think we have 8 nurses for that day that will be giving vaccines. We have people signed up to be greeters, people signed up to be parking lot attendants, and then just people to be signed up to be washing tables to make sure that the frequently touched areas are being disinfected. So if you do have an appointment for Saturday, please be patient. Know that we're doing the absolute best we can, and we're very excited to offer this opportunity. We'll be scheduling those second appointments for these individuals on Saturday for them to come back, same place, likely the same time, 4 weeks from Saturday.
I think, Heidi, last question with this, you probably are very thankful that you've worked with the Durand, Arkansas School District and the other school districts to do practice runs with mass vaccination, with the flu shot, with the students. And so you everybody kind of knows how this is all going to work, at least from your end of it with the health department.
Yeah, we have. I mean, we've really been doing mini mass clinics for many, many years. With the influenza, with the H1N1, we did some mass clinics. I can tell you that we haven't ever tried to pull off a mass clinic of the public of this scope before, so that'll be new to us. But there's a lot of plans and there's a lot of practicing that has been put in place Emergency management here in Pepin County, which is headed by Maria Nelson, has been an absolute godsend. She's extremely helpful. She gets us supplies we need. She helps with logistics, good partnerships in place. I am very, very thankful for a lot of things, and being part of a small rural community where people take care of each other and have a sense of pride of making sure that that happens. I am very, very grateful for everyone.
Again, if you're going to be attending the vaccination clinic, you should already have received that information. You should have already received your invite and a reminder. If you haven't received that, that means you don't have an appointment for this Saturday. So keep that in mind. Well, Heidi, again, thank you for joining us.
Yep, and the best way to get on that list and to get an appointment is to make sure your name is on that waiting list, because that waiting list is the list that we use. We already have 100 people who have registered for the wait list since Monday. So that provides us with an idea of how much vaccine we are going to need for that following week. So when we had to place our order on Monday, we looked at that wait list and tried to determine how many doses, and we had 100 people on the wait list. So we made sure that we ordered at least 100 doses for those people. So if we continue to get the vaccine the way we did this past week, I feel very confident that if you're on the wait list and you're in the 100 people that I just talked about, we will be vaccinating you next week.
All right. Well, Heidi, again, thanks for joining us.
Thanks, Brian.
Heidi Stewart, Pepin County Health Officer. You're listening to WRDN.